Okay, it looks like I'm live. Let's see if audio is coming through. Let's see. All right, audio is coming through. Okay, sorry about the delay there. Um, Last week, I tried out this new software for for streaming, and it started out really choppy. I'm looking like I had a little bit of choppiness, but once I got going, it seemed to keep up with me. So it looks like now it is keeping up. I have a little like frame rate status thing in the corner here, and it is green now. And last time, once I started streaming, it went green and it stayed green. So I'm really hoping that that remains the case. So the whole stream. So I've got the playback on my phone that's not connected to Wi-Fi. So I'm hoping that it stay, that it stays. It doesn't interfere, I guess is the right term. So if anybody happens to be watching live at any point during this stream, oh, I got a little choppy. Okay. At any point during the stream, if you're watching live and you have questions or you just have a comment or you want to chime in on something, please feel free to do so. I know a lot of people do watch afterwards. I know like my live viewers versus my after the live stream viewers are, very different numbers. So thank you for watching later if you are. But those of y'all who are watching live, or if you join in live partway through or whatever, at any of my streams, any week whatsoever, please feel free to jump in the chat. I do enjoy getting to interact with people. I've gotten to do it a couple of times on this stream, and I'd love to have more interactions with viewers live. If you are watching later, please go ahead and leave comments. Even though it's not live, it's not that live back and forth where I'm responding in the moment. It's still really cool if I can answer your questions and kind of have a back and forth with you. And of course, most of you who are watching this are coming from my Tumblr, and you know how to reach me on there anyway. So most of you guys are already interacting with me on Tumblr. So I understand if you're not like all that eager to chime in on the chat. But either way, let's get to it. So all of my like links and social media things are at the bottom here. I have my little lower third. It's one of the things I like about this platform is that it does seem to work really well for displaying things like that. And it's pretty intuitive for sharing my screen, which I'm going to be doing a lot of today. So recently, you may have heard of this, and probably if you're following me, if you've or if you're running in the same circles that I am, you've already heard about this a lot. But America's Frontline Doctors is a group of medical professionals. They are doctors. They have medical degrees and they all have different specialties. So they're not all, the same specialty, which is actually a good thing. It means that they're talking to each other. We should have different specialties talking to each other because, like I'm one person, one body, and I have all these different systems and they all work together. Like, people who specialize in different systems should talk to each other. It's all one system, right? It's all one body. But so they get together because a couple of them, and specifically Dr. Simone Gold, and I've retweeted a couple of her things. And I find this really interesting because she and a few other doctors basically said there's more to this COVID story and this hydroxychloroquine story and all these other stories than is being portrayed in the media. So she and her, kind of colleagues, or different doctors that she met through this process basically said, hey, wait a second, we need to educate the public about what's really happening because the public is hearing one narrative that's coming from the CDC or the NIH or whoever, the WHO or, whatever alphabet soup organization. And they're being told that they have to listen to this one narrative. And one of the things these doctors saw was that the narrative was one of fear. It was one of, you're going to die from this. You have to be afraid of your family members, your friends. You have to stay 6 feet away from them, and you have to, be afraid of catching their germs. And, it's this culture of fear. And when we have that culture of fear, that does not lead to anything good. I've never seen that culture of fear lead to anything good or anything positive. And they recognized this. And so what they did was they put together this conference where they got all of these doctors that are all kind of questioning, saying, well, what really is going on? And what, do people have to be afraid? And that was kind of the question, is like, do we really have to be afraid, or is there hope? Is there a solution to this? Is there treatment for COVID? Is there, are there options? Or is it this, like, we have to hide in our homes until there's a vaccine, right? So they get out and they do this big conference and they stream it for hours and people are watching. But it was this particular moment where they are out in front of the Supreme Court doing a press conference. So they kind of take a break in the middle of their summit and they go and they do this press conference in front of the Supreme Court. And they do this video, they put it up on YouTube, and of this press conference. And, my understanding of the timeline here, and I might be wrong, correct me if I'm wrong, but Trump retweets the video of one of the doctors, Dr. Stella Manuel, talking about hydroxychloroquine and her specific experiences, her anecdotal, that's anecdotal evidence. It's not a randomized controlled trial, it's anecdotal evidence, but that's still evidence. We just have to put it in the right category when we're talking about evidence. But she talks about her anecdotal experiences treating patients with hydroxychloroquine. And he retweets it, and this whole thing explodes. And I don't know if everything exploded because Trump retweeted it, or if it was already exploding and that's how he saw it. I don't know. And it doesn't really matter, because this video became one of the fastest growing, as far as views, YouTube video ever. Like, no video has ever grown that quickly at that rate. And gotten that big. It's 17 million views, just exploded, went viral, to use that term. And then it got shut down. It got taken off YouTube. It got taken off Facebook. It got taken off everything. And all of a sudden nobody could, it wasn't anywhere. And not only did they take down the video, but they started taking down other people's posts that were speaking positively of these doctors. And there's a live stream that runs, like, I think it's Monday through Friday, and then they have like a Sunday radio show, and it's the Robert Scott Bell show. And I don't agree with Robert Scott Bell on a lot of things. There's a lot of things he and I disagree on, but he was speaking about, like, he on his live stream was talking about these doctors. And that Robert Scott Bell has a lot of controversial opinions about healthcare and medicine, and he disagrees with the medical establishment and the pharmaceutical industry on a lot of things. So there's a lot of reasons that they could have for wanting to censor him, but they haven't censored him. He said a lot of things that are considered controversial on his channel, but they didn't shut down his stream live, midstream while he was live, until he started talking about Dr. Stella Manuel and these America's Frontline Doctors. That was what got them. It was hydroxychloroquine, not all of his other things that he says that I'm like, okay, maybe, or, I don't know if I agree with you on that. Like his anti-vaccine stuff, his, all these, in some cases natural, which I'm like, sure, they might be effective, but the way he talks about different things in the healthcare industry, I was like, I don't agree with with him on everything. But of all the things for them to say, what, we're going to shut you down midstream. We're going to pull your stream and send you an email saying that you violated our community terms of service. And this video might violate those. And I don't know, maybe this video is going to get pulled mid-game, and that's why I've got the playback, next to me. And this video might get pulled down later. I don't know. Because what YouTube told the Robert Scott Bell show was that it violates the terms of service to spread medical misinformation, which they defined as anything that contradicts the CDC, the WHO, the NIH, or any of these other official alphabet soup organizations. And if you contradict them or counter them or offer, an alternative explanation or an alternative theory, if you just disagree with them, you are spreading medical misinformation and you are going to be shut down. And it's this assumption that they are the ultimate authority that cannot be questioned. We cannot think twice about anything they tell us. We just have to accept it at face value, say, okay, and move, put on our masks, put on our goggles now, put on our hazmat suits, 6 feet away, whatever. Like, we just have to take it at face value. And otherwise, you're spreading medical misinformation if you say anything else. But these are doctors, they tell us to listen to the experts. They tell us to listen to doctors. And these are doctors research who do medical care, who are caring for COVID patients. The majority of them are actively caring for COVID patients, and we're seeing positive results from different treatments, including hydroxychloroquine and zinc, and including other treatments. And they were sharing this information. They're saying, here's what we're seeing. Here's what we're seeing about risk factors. Here's what we're seeing about treatments. Here's what we're seeing with outcomes. And then they also talked about, here's the things that we're concerned about in the way the research is being done by the CDC, the WHO, the NIH, the alphabet soup. And because they talked about, some of these studies that have been put out that just don't seem right. And the one thing was the one in the Lancet, and I reblogged a video about this pretty recently, or I retweeted, on Twitter, the video about this, where they're talking about their investigation into this study. And it was this, and it made huge news, when this study came out. And because it supposedly proved that hydroxychloroquine was not only ineffective for COVID, but was dangerous. And this is a drug that has been generic use for malaria and for some other illnesses for 50 plus years, 60, 70 years, I think since 1950. And they've been using it, and we know the side effects, we know what the impact is, and now all of a sudden they're saying it's dangerous and it's going to make things worse for you. But then some of these doctors said, well, we want to see the study. We want to read the study. We don't just want to, you tell us, give us a headline, the study says this, and then take that at face value. We want to read it. Because that's what you do with studies. You read them. They're meant to be read. Studies are supposed to be read. And that's what we're going to talk about mostly today, is how to read these studies for yourself. But they asked for the study, and then the study was pulled. Nobody was allowed to read it. And there were details, even just in the abstract, even just in the information they were able to get, that just didn't make sense. It was a huge study, supposedly. It was this huge sample size, supposedly. But nobody could actually look at the details. And so I'm looking at all this stuff, and I'm seeing these doctors who are asking these questions. I'm seeing more and more people ask questions. And then just as all of that is happening, just as we're having all of these things, then this article, and I'm going to pull this up here, and let's see if I can get it to pull up for you guys here. Sorry, there we go. All right, so here's this study, or not this article. I'm going to talk about the difference between an article and a study. And you won't be able to read everything on your screen, but it's a Forbes article. So this is Forbes. This is not some far right, far left, crazy, whatever. This is Forbes. It's a fairly well-trusted, publication. It primarily talks about, financial news and things like that. It's not a health science outlet. It's not even a science related outlet. It's financial primarily. It caters to primarily people on Wall Street or investors or people who are generally concerned about the economy. And just anybody in general who wants to know what's happening to our economy. You don't have to be a Wall Street person to read Forbes, but it's mostly business. It's mostly financial news. And Forbes puts out this article. You must not do your own research when it comes to science. And I just want to point out too, so the link for this article is in the description on this video on YouTube. So if you go into link, I've got all my links for everything I'm going to show you today. It's all there, including the link for the America's Frontline Doctors, including all of this. All of it's in there. But this article is written by this guy who's apparently an astrophysicist, Ethan Siegel, and he has some group. He's part of some contributor group that writes articles for Forbes called Starts with a Bang. And the little byline, this is what I thought was so interesting. The little bio thing under there says, the universe is out there waiting for you to discover it. But then he says you must not do your own research. So how are you supposed to discover the universe unless you can do your own research? And what he tells us is that we as everyday people might misunderstand scientific studies. And so therefore we shouldn't read them ourselves, and we should just listen to the experts. But as we saw this week with America's Frontline Doctors, Dr. Stella Manuel, Dr. Simone Gold, we can't listen to just any old expert. We have to listen to the expert who agrees with the alphabet soup, who agrees with the CDC, the NIH, the WHO, the whoever. There's a specific narrative that we're supposed to listen to. It's not experts in general. It's not just any person who's an expert that we are supposed to listen to. It's the narrative. There is a narrative. And if we are not listening to that narrative, or if we're questioning that narrative, the author here says that may be dangerous, even deadly. And he brings up several things: vaccinations, change, and COVID. As in, these are all things that are considered settled science by a group of scientists, not by all scientists, but by a certain group. And anytime you hear somebody say settled science or consensus, or this is just what science says and there is no dispute, you should question that. Doesn't mean that they're necessarily wrong, but you should question it, because science is not designed, like the scientific method is not about a status quo, like enforcing a status quo or enforcing a narrative. The scientific method is all about questioning and saying why and what if. And if you are saying this is settled, we don't need to question it anymore, especially for a virus that has been around less than a year. This virus has existed, or at least we've known about it less than a year. So to say in less than a year that all the questions that need to be asked have been asked, you don't need to question anything anymore. And we know exactly what we're doing, even though we changed our minds and changed our story a million times. I'm like, do you understand what science is? And you're an astrophysicist. You've taken however many science classes over the course of your life, and then you write this, and you write for a group that encourages people to go discover the universe, and then you tell us that we must not question science and we must not do our own research. And my question to Ethan Siegel is, how do you become an expert in anything if you cannot do your own research until you are an expert? So what I want to share with you guys today is what I understand and what I've learned over the years, and also what I've learned from my research methods and statistics classes in college. I did take research methods, statistics, and a few other similar kind of classes. In fact, a lot of the classes I took in college talked about research methods and statistics and how to read these papers and how to write these papers. I wrote, scientific, I took biology classes, and we did experiments, and we wrote them up like they would go in a journal, and and we were held to a very high standard on these. So I've been on that. Like I know how to look into these studies. I know how to read them. And there's sometimes where there's jargon that goes over my head because I'm not an expert in that field, but I know how to look stuff up. And I know how to use the context clues within the article. I know enough about how these articles are written and how they're laid out, that even if I don't understand everything that's in it, I can get the idea, and I can ask questions. I know enough that I can ask questions. So I want to show you guys a couple of things that I understand, that I've learned, and I'm going to take away my lower third overlay just so you can see everything. There's a few terms that I think people need to know if we're going to read scientific studies, because my goal here is not to discourage you from reading science. I want you to read science. I want you to read studies and ask for studies. When somebody makes a claim, I want you to ask for the studies. But if they give you the study, I want you to know what to do with it. It's one thing to say, oh, I have a study, there's this study, there's that study. And you look at the news, every day there's an article that's like, there's a headline that says, new study shows, blah, blah, blah. And it'll make some outrageous claim, and you're going, oh my goodness. But if you understand how to read these studies, you'll understand most of those headlines are blatantly false, or at least misleading. So I want to talk about how we read these studies. And there's some important vocabulary that comes with these that you need to understand. First one is randomized controlled trial. And if you learned about the scientific method in school, whether it was elementary, middle school, high school, college, whatever, you've learned about randomized controlled trials. This is when you have, dependent and independent variables. You have all your variables controlled. You randomize your samples. And this is really important. You have to randomize your samples so that you're getting rid of any extra variables that you're not otherwise accounting for. Sorry, I thought I got rid of the lower third. There it is. Now it's gone. So the randomized, like you have to randomize it. You have to have the variables be controlled. It has to be repeatable. You have to have multiple different groups that you're comparing, and that you have, a control group and an experiment group. If you learn basic scientific method, this is kind of your basic level experimental design. And this is also kind of the gold standard of scientific experiments. Now, not everything can be done with a randomized controlled trial. There are certain things that just don't lend themselves to that. But that's the thing, is those things that don't lend themselves well to randomized controlled trials also don't generally lend themselves well to science. Things that you can't repeat and control and manipulate in an experimental setting may not be the best thing for science to answer. There are some things that science can't answer, and that are not, or there are some things for which science is not the best tool. Science is a tool. It's not a religion. It's not a philosophy. It's not a worldview. It's a tool. And it's used to answer specific types of questions. And the questions that are best suited to science are the ones that can be answered with a randomized controlled trial, where you can have an independent and dependent variable. You can have sample sizes and populations and all of this. So you want to look for those words randomized, especially randomized sample. If you're looking at a study and you're trying to figure out, is it a randomized controlled trial, and it doesn't say, it should say in the abstract or somewhere in the kind of the beginning of the study or the beginning of the paper, it should tell you if it's a randomized controlled trial. But if it doesn't, you want to look for words like randomized sample, right? You want to look for words like control groups. What that tells you is that the researchers who are doing the study have accounted for other explanations for their results. Because if they don't randomize their sample, if they don't control their variables, and then they get a set of results and they say, here's our conclusion, but they haven't accounted for the other variables that could have impacted their results that they weren't looking at, then those results can't necessarily be generalized to like broad conclusions about how we should live our lives. And so if you don't have randomized controlled trials, I would be very, very suspect of anybody who's trying to say, well, this study says we should do X. And you should ask questions. That doesn't mean you should throw it out altogether. It doesn't mean that randomized controlled trials are the only acceptable type of study. It just means that if it's not one of those, you really should question it, and you really should ask them some deep questions. And I'm going to go into some of those questions in a little bit. Double-blind placebo trial. And let me get my little... There we go. My little pointer here. Double-blind placebo trial. So that is whenever you're trying a medication or an intervention, or like you're just trying to see if something works. Double-blind placebo trial is where you have different control groups. You have a group that doesn't get the intervention, whether it's a medication or a procedure or whatever it is, the one that they don't get it. You have a group that thinks they're getting it, but they're really getting a placebo. So they're getting some kind of inert, non-effective version. So in a case of a medication, it's usually like a sugar pill or an IV drip or something like that. So it's something that's not going to really do anything to them. It shouldn't do anything to them. And that takes care of the psychological, just believing that you're getting treatment can actually cause your body to heal from things. And so there's some things that have a placebo effect where just even though it's not really doing anything to your body, because your body has decided, let's see what's happening here. Okay, I think I'm back. Okay, I was having some issues for whatever reason. My frame rate drops. Apologize for that. I'm just going to wait for that to go back up before I start talking again. Okay. Good. Okay. All right, I'm going to stop sharing my screen for a little bit, and we will see that fixes the problem. Okay, I think that has fixed or mostly fixed the problem. Gotta keep going and see if that gets better. But I am gonna pull back up my slides. At least have them as notes, even if I'm not showing them to you right now. So pardon me while I do that. You know what? We're gonna share screen again and see if we can do this, because it really helps if I can have my notes for you to see. Okay, I think this is working. Okay. I'm going to keep going. We'll see what we get. At the very least, you should be able to see what I'm doing, even if not everything is, even if you can't hear everything I'm saying, you should at least be able to see what I'm doing. And the links are all down in the description for everything that I'm talking about. So anyway, get back to this. So the placebo trial, the placebo part I explained, we more or less understand what a placebo is and how it impacts study results. But the issue is the double-blind part. So the double-blind part means that not only does the person not know whether they're getting the placebo, the real medication, or no medication at all. Like, they don't know which group they're in. Now, if you're not getting any medication, then you already know what group you're in. But if you are in either the placebo group or the group that gets the medication, you don't know which group you're in, and the researchers don't know. So what you do, have this little thing where it's like the A and B are labeled, or it's like A and B, and then you kind of mix it up. And basically, nobody participating in the research knows, I've got a little bottle labeled A. I don't know if A is the placebo or A is the real thing. I don't know. And that's important, because it means that I, as the researcher, am not going to affect the results by the way that I talk to the patient. I might treat a patient differently if I know I'm giving them the placebo versus the real thing. Especially, like, think about like a cancer trial. Think about, like, you got somebody who's suffering from cancer and you're giving them a placebo that's not the real medication. You're going to feel some guilt, because you're going to feel for this person who thinks that they're getting the real medication. So the double-blind aspect of it really helps control for that, and lets it be a very objective experiment. And so the double-blind placebo trial is really good anytime you're looking for a medication or intervention of any kind. Now, for masks, we can't really do a placebo. And that's actually a good question. That may even be a matter of, maybe if you you could potentially do a placebo if you had something that looked like an N95 mask, but wasn't really. Somehow you made like a fake N95 that doesn't really block 95% of particles or whatever, but it looked like one. It looked very medical and official, and you had people wear those too. And that would be interesting as a placebo trial. Just because it would be important to know, are any benefits from the mask or any risks or harmful effects from the mask? Are they because of the mask itself, or are they because of how we perceive the mask, or we think we're safe, therefore our bodies respond better, something like that. Those are things to look for. You want to make sure that you don't have other factors that are messing with your results. Another one is mathematical model. This is a big one because I've seen a lot of things lately, a lot of headlines that have said new study shows this, and it really is a mathematical model, and they don't say that up front. They don't say that until you dig down into the article a little bit. And what we need to know about mathematical models, I'll talk more about them later, is that they are an algorithm and a prediction. They're a prediction of future events based on assumptions. So it's not a study in the sense of we tried this multiple times and we saw what worked. It's we have these assumptions from this prior data that we have from whatever study. We list those way down deep in the article, so you have to go look at those studies to see if our assumptions are even any good. We plug in those assumptions, we plug in this data, and we get this prediction. And unless you're questioning the assumptions, the data, the algorithm itself, unless you're questioning all those things, you're just taking it at face value and they can say whatever they want. Like if you don't question that stuff, I could say that handing out free bags of Cheetos will reduce cancer deaths because I create a mathematical model that plugs in number of cancer deaths per year, number of people who get diagnosed with cancer per year, and then the assumption that Cheetos prevent cancer, right? And so if I do that, if I plug in all those things, like the first couple of assumptions were valid, or first couple of pieces of data were valid, number of cancer deaths per year, number of diagnoses per year, blah, 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 blah. But then I put in my own little assumption that isn't data-driven. And if all I put is the headline, handing out free bags of Cheetos will prevent cancer, and I'm a well-respected researcher or from a well-respected university research institution, it's important that you know how to question that. When something sounds crazy or doesn't sound like it doesn't make sense, or even if it does kind of make sense, but you're like, I want to see the data. It's important to know what you're looking for. And then meta-analysis or review, that is when we are looking at a bunch of different studies over a period of time. So a lot of times when you'll see a study and it's really a review of the literature, meaning it's a review of all the studies that have been done on this over the past 10 or however many years. And so it's really important to look at how they chose the studies and to look at the individual studies that are used. So if you have 20 studies that are used in this meta-analysis, it's really important to look at those individual studies and make sure that they are good studies. And then we have peer review. We should all kind of know what peer review is. It's the idea that other scientists, other experts, are reviewing the literature and giving feedback to the researchers. So this is the thing with the Lancet Study and the America's Frontline Doctors, because they asked to review it. They said, we want to see the study. And they refused. The Lancet or whoever originally did the study wouldn't give it to them. And so that is highly questionable. If it's not peer reviewed, if it's not been reviewed by different people who were not involved in the original experiment, who aren't from the same university or the same company or the same institution, it needs to be reviewed by a wide variety of people in that field and sometimes in different fields, depending on what the study is about. And then we have a reproducibility, and this is a really big concern for people right now because there is some evidence that some of these academic journals and scientific journals are not emphasizing reproducibility when they decide what to publish. You need to know that something that, when scientists publish a study and they said, we got these results, you need to be able to reproduce those results. If you follow, ideally, if they wrote their study well, you should be able to read their study and follow from what they wrote in their study. You should be able to follow the steps that they followed and get the exact same results or very similar results. And you should do that. That should be done by research institutions, by universities, by whoever has the funding and the resources to do so. Because by trying to reproduce the results, we can determine if those results were valid or just a fluke. They could have been a fluke. And so reproducibility is really important, and it's a sign of a good study if they mention reproducibility, if they call for further research on the topic, they want people to try and do it themselves, or if they say, we're doing this study because of this other study, and this is now the 5th study that has found the same results, and that's what those meta-analyses are for. The literature review studies is to basically say, okay, we did all these studies. Did we get more or less the same results, or is it kind of mixed? And if it's kind of mixed, then maybe this hypothesis isn't quite correct, or we need to adjust the hypothesis. And then significant difference. This is one that trips people up all the time. Significant difference is a mathematical, statistical term. It's not about, the subjective importance of something. It's not about how big of a deal it is. It's about whether there is enough difference in the data to be more than just a coincidence, more than just a fluke. So you want to look for significant increase or significant decrease. That doesn't mean it increased or decreased by a whole lot. It means it increased or decreased by enough to be more than just a statistical error or a fluke. And so there's calculations that go into whether something is statistically significant, but you want to look for those statistically significant differences, whether it's significant increase, significant decrease, whatever the case may be. And so it's important to know what that means, and that is specifically talking about a statistical term in the data. And what are they saying significantly increased or decreased, and what are they saying they think is the cause of that increase or decrease? And then when you look at the study, there's some questions to ask. Number one is who paid. We have an issue where pharmaceutical companies will do a study and on a drug, they are, okay. Okay, there we go. I'm getting my frame rate back. Sorry about that. So the pharmaceutical company will pay for the study on their own drug, that they have a profit motive in getting out to market. And they may influence how the study is done, who does the study, who's involved in the study, how participants are selected, and you need to watch for that because they can have very subtle influences can have a big impact on the study results. And also any organization that has a vested interest in the results, you need to watch and see, okay, what interest do they have and how much autonomy did the researchers have? Were the researchers connected to were they employees of the people who paid for it? Or were they kind of independent researchers that simply got funding because this institution, this company, this agency was interested in the results? So just because it's paid for by somebody doesn't mean it's wrong. It just means we should ask the question. Look into it. We should just look to see, did they have an impact on it? Then again, the replication or the reproducibility, have these results been replicated by others? And so this is why scientific research takes a long time. And so when the media is constantly doing, there's a new study, a new study, a new study, a new study every single day, you need to question that because scientific studies take years. And when we talk about coronavirus and COVID-19 specifically, which is a novel coronavirus, a new virus, and when they're constantly putting out studies, we need to ask those questions because good studies, good experimental research takes years, not months, not weeks, not days, years, because you have to, look at all the data that you have up front, come up with your observations and your hypotheses, design an experiment, get the funding, implement the experiment, gather the data, analyze the data, write up the paper, send it to others to review, get their feedback, make adjustments, and then finally publish it. That takes years. It does. That's why when you read a study that's from 2012, the actual experiment was usually done in like 2008. You read a study that's published this year, the research is usually done like 4 years ago, 2 years ago, maybe 1 year if they're really rushing it. But to have all these new studies come out in 2020 about a virus that we discovered, or that scientists, experts, whoever discovered in late 2019, you should question that. That should be suspicious to you, right? You should be suspicious of that. The other one is, what were they trying to measure? So I've seen some where there's some really misleading headlines, and the headline is about something totally different from what the study was about, or even the study title doesn't quite match up. So you just look at, are they really measuring what the study is talking about, or and is the methods that they use, does that really make sense for what they're trying to measure? How were participants selected? There's a lot of biases that go into if you select volunteers. Like if it's like, hey, sign up for this study, you're getting volunteers, and there's some differences in the, you got the type of people who volunteer for studies and the type of people who don't. And can the results from the volunteers be generalized to the people who didn't volunteer, who weren't in the study. And sometimes there are biases there. Not always, and you can control for them sometimes. There's ways to control for that, but you need to ask, how are the participants selected? Do the participants represent a cross-section of the general population, or at least the population that you're primarily working with? Like, let's say you're doing a study on a medication for people with heart disease. You need to make sure that you look at all the people who have heart disease. You need to make sure your sample size, your participants, represent a cross-section of all the different demographics and all the different walks of life, of the people who have heart disease. Like, that's a very diverse group of people. And you need to make sure you're not just getting one small subgroup of your population that you're trying to study. And then we have what biases and assumptions, and that goes back to the mathematical models and the assumptions that are worked in. And same thing with any study. What assumptions are we making that we're not questioning in the study? What biases do we have? What do we want the result to be? And is that impacting how we do our experiment? And then, does the data support the claims the researchers are making? Sometimes every once in a while, you will have an abstract, which is the summary, the kind of the intro thing, and the abstract gives you what they're studying, the methods, the results, and their conclusion. It's like one condensed thing. It's a TLDR of the study. And you're looking at that bottom part where there's a conclusion, where they say, well, so what? What do we conclude from this? You need to make sure that conclusion matches the data that's actually in the study. Every once in a while, I will see a study where they have the data, and then they come up with some total conclusion that has not, this was clearly the conclusion they wanted to come to, and not actually what the data showed. Or the data was not as clear as they're making it sound like the data was more clear than it was. And that's usually what it is. So those are important questions to ask. This is an example of a study that, and I just want to kind of show you some of the things in the study. And again, this is linked. It's a study about face masks in Japan. So the link is down in the description below. But some things that I, looked at in the study. First of all, it is a randomized control trial. It is an RCT. That's important to know. And so usually it will say it either in the title of the study or really early on in the study. So you can even, control F for randomized or controlled or anything like that. Then we have down here, it says they were randomized into two groups, one that wore face masks and one that did not. And they provided information about their demographics, etc. So you have a control group, or you have a group that doesn't wear masks and a group that does. Now, and that should be sufficient for the kind of study that we're doing here. You could potentially do other control groups, like I've seen studies where they have a group that wore masks part of the time, and then you can also do between different types of masks. Cloth masks versus N95 versus surgical masks, whatever you're looking at. So there's room for more there, but at least they've got the two groups that are randomized, and they are randomized. Then you have, it says that participants recorded symptoms daily for 77 consecutive days. So these are self-reported symptoms. And the problem with self-reporting is there is bias, and participants aren't always 100% honest or 100% accurate. Sometimes they're what they think the researchers want to hear. That's always an issue. Like, oh, I think the researchers want me to say this, even if it's not really what's true. There's sometimes people will do that, or you're kind of over analyzing what you think is going on. Then you have it's only 32 people, so sample size is kind of small here. But they do acknowledge later that they should do another larger study. So this is kind of an intro study. This isn't the final conclusion on face masks. This is just one study. And it they said significantly, the mask group is significantly more likely to experience headaches. So significantly more likely, that's a statistical term. And it means that they had more headaches, and it was beyond just a statistical error or coincidence. It's not just a coincidence. It's too many people to simply be coincidental. And they had headaches from wearing the masks, and we recognize that that's probably from reduced oxygen intake. And that's a concern with these masks. And so, and then it says, the conclusion says a larger study is needed. And so this is good, because they're not claiming that this is the end all be all of this issue. They're not claiming that the issue is settled. They're saying this raises some questions. Let's look into it further. And that's a good study. They're not making broad sweeping claims. They're not doing crazy headlines. Now, somebody like CNN might make a crazy headline out of it. Probably not CNN, probably Fox or something for this particular study. But the specific, the study itself does not make those kind of crazy claims. So there's these are the studies that I would question when people share them as like, this study shows this. Mathematical models, like I've said, those can be based on faulty assumptions. And so if somebody says, oh, we have this mathematical model, you need to ask, what are the assumptions and what is the data that the mathematical model is using? And make sure that those assumptions and data make sense. Surveys, anything where it's self-reporting. So the study I just showed you, that was self-reporting. There are biases, there are errors that come when people are simply self-reporting symptoms or experiences. And then we have observational studies, which is where people are living in their day-to-day life. And usually those come with self-reported and survey kind of symptom or survey settings. In observational studies, you have other variables that may be impacting results, and are you taking those into account? And what else could be explaining these results? So here's an example of a this was in May. CNN is my favorite for if you want examples of the media sensationalizing studies and not reporting on them accurately and not questioning them. CNN is a great resource for that. So I have a couple of them from CNN. And they say, so wearing a mask at home could help stop coronavirus spread among family members. A new study says. Okay, so this is wearing a mask at home around your family could help. And to some extent, we can kind of say, oh, well, maybe, all right, we understand it can spread between family members, and that's actually primarily where it spreads. But what is the study? How did they study this? And again, how has this been reproduced? Has it, only had this virus for a few months? And to try and do this, say this like the study says this, without having multiple studies and reproducing results and all of that, that's a little tricky. So if you go into the article, and I linked the article below, I linked the tweet and the article. It's a self-reported study. So it says they called 460 people, and this isn't done in Beijing, so it's done in China. And they asked them about their household hygiene during the pandemic. Now, number one, my biggest concern here is the cultural impact of, okay, you're in Beijing, you're in China, where you do not have freedom of speech. You have to watch what you say. And you're being asked about your hygiene practices during a pandemic, where China has welded people in their homes because they had the virus to keep them from spreading it. So I'm just saying, if I lived in China and somebody called me asking about my hygiene practices during a pandemic, I'm gonna lie. I'm gonna exaggerate how clean I am. So I think there's gonna be some issues there as far as people accurately reporting how well they're sanitizing, how well they're doing all these things. But so it's all self-reported, and they acknowledge, if you look down here, it says it's not enough. They say it's not enough to make any official recommendations, but the headline on CNN says this study says we should wear masks at home. It says study shows that wearing masks at home can help, but they say in the article on CNN, not even in the study paper itself, but in the article, down at the bottom, they say that there's problems with this and that you can't make official recommendations based on the study alone. So if you look at this article, you'll see that information in there, and it says it's not robust science. They say this is not robust science. This is not a good study, and it has limitations, and that it is not looking at the individual level. It's looking at the family level. And it didn't make a distinction between whether the families were wearing N95, surgical, or basic cloth masks. And I think there was also something in the study itself that talked about how it didn't look at what kind of cleaning products they were using. It just asked if they were clean, kind of thing. And that's not necessarily helpful. So this is a great example, one that you should question. And so if I go back to that kind of headline, you see this headline, and somebody retweets this, somebody shares this, and you see this on your timeline, and you say, oh, wearing a mask, I better wear a mask at home. And then you have, celebrities saying, make sure you wear your mask at home. And nobody's actually looking at the study, and the study itself is not good. Here's another one. Coronavirus outbreaks could be stopped. And this is the one that I keep seeing, this one or a variation of it, and it drives me up a wall. Coronavirus outbreaks could be stopped if everyone used masks, washed their hands, and kept apart from others. That's what they're saying. A new study finds. A new study. What study? How did they do the study? And this is one that is a mathematical model. So it says, it says, according to new studies, that this study, published Tuesday in a journal, blah, 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 created a new model to look at the spread of the disease and prevention efforts. So it created a new mathematical model. This is a prediction based on assumptions and some data. Question is, are these valid assumptions? And is the data valid? It says the contact rates in the study were based on people's interaction in the Netherlands, but they assume that it's appropriate for other Western countries such as the US. They assume that what is true in the Netherlands will also be true in the US. And there's a lot of reasons why that might be faulty. There's a lot of differences culturally between the Netherlands and the US, and also just how our infrastructure is set up and all of these. There's all these differences that they're not taking into account here. And they're just assuming it applies to us as well. And it also looks at, there are limits to the model, doesn't take into effect demographics or imperfect isolation, and it doesn't account for reinfection. And these are all things that we should be accounting for before we say, oh, we can stop it if we just wear masks. And also, what they don't say in the CNN article, they're also assuming that the masks prevent the spread of the virus. This is not a randomized controlled trial on the effectiveness of masks. The mathematical model that assumes masks are effective. And I think it does say up here, it says that that they're using, or I think in the CNN article itself, and you can look it up, it's linked in the description below. It says they are using information from the CDC. Actually, no, I think it says it here. So here's from the article, which, or the research study paper itself, which is linked in the CNN article, which is linked in the description below. So a couple of link clicks and you'll get there. So here's methods and findings and conclusions. So methods and findings, it talks about self-imposed measures. It talks about this. Here's my favorite. This model was parameterized using current best estimates of key epidemiological parameters from COVID-19 clinical studies. Couple of problems here. Number one, parameterized means that these are the assumptions, these are the parameters that we are using for this study, for this model. I don't want to call it a study, it's a model. And so we're looking at, okay, what are the assumptions they're making? They're using best estimates. Best estimates. My best estimate is blah, blah, blah. That's not sound robust data. That's an estimate. That's somebody's educated guess. Not a random guess, not a wild guess, but an educated guess. So maybe based on data, we don't know what data. We have to look further to see what data. But again, we're digging in deep. We're not just taking this at surface level. Then it says key epidemiological parameters from COVID-19 clinical studies. Again, good research, valid studies take time. If you are doing real experimental clinical research, it takes years. This is COVID-19. It was discovered in 2019. That's why it's called COVID-19. We have not had it for years. We do not have an abundance of clinical studies. And when they say clinical studies, that can mean all kinds of things. It should mean randomized controlled trials and double-blind placebo trials and things like that. But it doesn't necessarily. It can mean a lot of things by saying that. But we don't have a preponderance. We don't have this abundance of clinical trials and clinical studies on COVID-19 because we haven't had the time. It'll take years before we really have good studies on this because it's a new thing. So to say we're using key epidemiological parameters, well, what are those? Publish those, show those to us. Let us look at those. And then we estimate that a large epidemic can be prevented if the efficacy of these measures exceeds 50%. They don't say compliance. They do not say compliance. Please note this. The efficacy, the effectiveness. Efficacy means how effective is it? The efficacy of these measures. So we are assuming that these measures, The washing your hands, which, I mean, we should all wash our hands, but the washing your hands, wearing a mask, and staying distant from each other, assuming that that's going to be at least 50% effective. That's a huge assumption. Say, if it's 50% effective, then we'll be able to do this. And then they say we can prevent a large epidemic, but then what they say is it says it will mitigate and delay the epidemic. It doesn't say that we'll prevent it altogether. It says it'll mitigate it, make it a little smaller, and delay it. And then it says it can buy time for the healthcare system to prepare for an increasing COVID-19 burden. That's what they said at the beginning in March, when they said we need to shut down for 14 days so our hospitals can get ready. That's what they said. And now they're not saying that anymore. They're not saying slow the spread and prevent, prevent the hospital overload anymore. They're not saying get the hospital. They're saying we have to prevent anybody from ever getting this, And so this is like outdated talking points, but they're talking points in here. And it's this idea that, oh, we just need to buy time. We've bought time. The time has been bought. But CNN is sharing this study as though like, oh, well, we just need to wear masks. If we just, just lock down for 15 days, if we just do this, if we just do that. And now saying like, oh, well, we can buy time. We bought the time. The time has been bought. It has been bought with an economic downturn, with the deaths, the suicide deaths, the child abuse deaths, the domestic abuse deaths of thousands, if not millions. Okay? It has been bought with death. We bought the time. It's time to move on from this idea that we are slowing the spread until the hospitals can catch up. They've caught up. They're ready. They are. They can handle it. It's time. It's time to use all that preparedness that we did. So all of this is to say that it is important for you to not listen to Forbes on this one and not just stop doing your research because you don't understand everything. And I get that this may have been information overload for some people, or some people may be intimidated by some of these studies, but it's important that when you see somebody when somebody goes, hey, there's a study, this study says, studies show, that you actually look at the studies and you ask that person, show me the study. Send me the full text, not just the abstract, but the full text. The abstract can tell you a lot, but there's stuff that's not in there that you need to know. Send me the full text of the article. Send me the full study, not just the news article that talks about the study. Send me the full text of the scientific paper in the scientific journal and let me read it. And then, even once they send that to you, say, you know what? We need multiple studies. We don't just need one study. One study does not create a scientific consensus, but one study can cast doubt on a narrative. So if you have one study that contradicts the narrative, that calls for more studies. But in order to establish a narrative and establish a consensus, for lack of a better word, you need multiple studies. So one study is enough to cast doubt. And you think about it like beyond a reasonable doubt, as a standard of evidence in a criminal trial. Think about the hypothesis being put on trial. If there's a reasonable doubt, if there's any reasonable doubt, then we say no. We're not there yet. We don't have all the information. We don't have all the evidence. But once you go beyond a reasonable doubt, once you get to the point where it's like, no, there's really no other explanation for this, then you can say, okay, now we think it's this. But to have one study and say, there we go, it's settled, it's not. So when somebody says, the studies show, the science says, the science is settled, you need to question that. You need to ask them for the studies. You need to look at the research. You ideally should be looking at some meta-analyses that take a whole bunch of studies and analyze them. That's what you want to look for. And then you also want to look for studies that contradict. Do any studies contradict, and why? And what was the difference? So I hope this was helpful to everybody. Please let me know in the comments if you have questions or if there's studies that you want me to look at. If you have a study that you want me to take a look at and give you my opinion on it, you can put it in the comments below and I can look at it and tell you if it's a well-done study or what questions you should ask, that sort of thing. So thank you guys so much. I'm going to put my lower third display up here real quick, just for a minute. Oops. Here we go. There's my lower third. Okay. So I'm gonna put my lower third up there, but just thank you guys so much for watching. And there's all my social media and all that kind of stuff, and all those links are in the description below. And also please in the comments let me know if you have things that you want me to talk about next week. And otherwise, I will see you guys next week on Pro Life Pro Liberty Live.